truly to, when you allow that to truly sink in. So if you look at all of these issues, really it represents 83 million cases of physical health issues within a single year. Next slide, please. In this pie chart, you can see the majority, or 88% of physical illness in the United States is due to four main causes. So you see there injury leading the way with 47%, followed by heart disease, cancer, and then respiratory diseases. Next slide. Physical health is just one piece of the whole. Often related to physical health issues is the factor of mental health, as I mentioned at the start of my presentation. To understand the extent of the scope of the problem of mental illness in the United States, however, I wanted to share just a few stats with you. So the National Institutes of Health reports that 1 in 5 Americans, or 43.4 million adults, deal with a mental health issue in any given year. In a single year, more than 18% of us, or 40 million individuals, experience a major anxiety disorder. And by anxiety disorders, you know that those are things such as panic disorder, post-traumatic stress disorder, obsessive compulsive disorder, or a specific phobia. 16 million experienced a major depressive episode, major enough to interfere with day-to-day functioning. Depression is, in fact, one of the most common complications of chronic illness. Up to 1/3 of individuals with a serious medical condition experience symptoms of depression. The rate of depression among individuals who have suffered a heart attack, for example, is between 40 and 65%. More than 20 million struggled with a substance abuse problem, and half of those 20 million had a co-occurring mental illness. LGBTQ populations have amongst the highest rates of tobacco, alcohol, and other drug use, as well as depression, putting them in particular at a higher risk for chronic and severe health problems. Studies find that 18% of employees between the ages of 15 to 84 report that they experienced symptoms of a mental health disorder in the previous month. So likely, and hopefully, those statistics are eye-opening to you. Mental health issues don't often get the same kind of attention and also, very importantly, funding that physical health issues receive. And yet the number of cases per year are higher, with potentially more Americans impacted by these types of health issues than we actually know about. On the next slide, you'll see the impact that each of the top 10 prevalent mental health issues have annually on the US population. And I just want you to note that cases often occur hand in hand with both physical health issues, concurrently working with other mental health issues. On slide 6, what I'm showing you here is the 10 most prevalent mental health illnesses in the United States. So just taking a quick look there, I won't go through them all. According to the 2016 US Census, there are 323.1 million people in the United States. So according to the data presented here, there are well over 100 million cases per year of just the top 10 prevalent mental health illnesses in the United States. So these numbers, when we really let them sit in with us, they truly do illustrate the enormity and the scope of the problem. Next slide. This pie chart, as you will see, the majority, or over 75% of mental illness in the United States, comes from three main areas: anxiety, substance abuse, and depression. While we look at these numbers, remember the statistics that I shared with you just a little bit earlier. 1 in 5 Americans are experiencing a mental health issue, and so most likely to be in one of these categories listed here. Slide 8. Since the beginning of the 20th century, much has changed in the way that we understand and manage our health. Our system of healthcare is evolving from a focus on treating the body as a machine with interventions focused on disconnected parts to systems of care based on an explosion of research detailing how the physical, environmental, and emotional components of our lives intersect to impact health and illness. Our old assumptions about the separateness of body and mind, action and thought, and societal versus individual factors are now seen as having no more validity than the flat earth assumptions of the Dark Ages. Society is gradually coming to understand that overwhelming stress and mental health issues are common in our day-to-day lives. But despite the fact that they represent a significant portion of the public health problems facing the United States, mental health issues tend to fly under the radar. Fewer than half of individuals with diagnosable mental health conditions receive the treatment they need. While we focused as a nation on issues like healthy eating, smoking cessation, exercise programs, and access to prevention programs, there is mounting evidence that we cannot and should not stop there. It's not enough to address physical health issues. We simply must make mental health a part, not an add-on, but an integral part of our public health agenda. It's a matter of backing up and looking at the whole person rather than trying to assign and address a single diagnosis. We simply have to start dismantling the symptom-specific silos that have prevented us from using an integrated approach to medicine and erect in their place a system that draws on information from both sectors, the two birds with one stone approach. Mental and physical health issues, as I mentioned, are inextricably intertwined. The next few slides that I'm going to show you will provide some examples of how physical and mental health illnesses have been found to have a causal, concurring, or resultant relationship. Research has shown us that our bodies respond to excessive stress by sounding the alarm through our bodies and our thought patterns. When we ignore these signals and fail to change the stress or the way that we cope with it, mental health and physical health concerns arise, even in healthy people. So the next slide. Let's look at a few specific correlations here. Major depression, as we see, is significantly linked to heart disease, cancer, stroke, and diabetes. Generalized anxiety disorder is linked to heart disease and cancer. Bipolar disorder and schizophrenia correlate with cancer, and eating disorders correlate, of course, with diabetes and heart disease. So some facts that you may already know. Mental disorders, and I purposefully belabor here depressive disorders, interfere with our ability to manage many chronic diseases such as cardiovascular disease, asthma, obesity, diabetes, and cancer, significantly increasing the cost of care and severity of the illness. High levels of stress and mental health problems such as anxiety and depression are associated with an increase in behaviors such as smoking, substance abuse, physical inactivity, and insufficient sleep that puts us at risk for many chronic diseases. In the healthcare and public health arena, more emphasis and resources have been devoted to screening, diagnosis, and treatment of mental illness than to the promotion and maintenance of mental health. Persons with serious mental illness die 25 years earlier than the general population, often from conditions caused by modifiable risk factors such as smoking, obesity, substance abuse, depression, and inadequate access to medical care. 60% of premature deaths in persons with serious mental illness are due to physical conditions such as heart, respiratory, and liver disease, as well as stroke and cancer. Even though laws require health insurers to provide mental health care along with other health services, I'm sure many of you are familiar with these parity laws, significant regional disparities exist in the availability of quality mental health services. Next slide, please. One prime example of the connection between mental and physical health can be seen through the study of adverse childhood experiences known as ACE. The Centers for Disease Control and Kaiser Permanente last year completed a study on the long-term effects of these sets of specific traumatic or stressful life events that occur before the age of 18. ACE includes a wide variety of childhood experiences that can have long-term physical effects, physical, emotional, and sexual abuse, mental illness or substance abuse in the household, parental separation or divorce, a parent who is incarcerated, an abusive relationship between parents, or on a somewhat subtler but equally damaging level, emotional or physical neglect. While many of us have experienced one or two such events, for example, mental illness in the households that we grew up in, perhaps substance abuse of a parent, parental divorce or separation, the experience of 4 or more ACEs is linked to every major chronic illness and behavioral health problem. These are the same healthcare and societal problems that cost American taxpayers billions of dollars every single year. ACEs cross the line between stress and trauma, disrupt brain development, and impair functioning in many critical areas. These changes set in motion while our bodies and brains are maturing. They alter the way our nervous system responds to stress, disrupts our sleep patterns, affects our trusts of others, impairs our concentration, and increases the likelihood that unhealthy habits and addictions will develop. Children with high ACE scores who do not receive proper treatment by adolescents are at the highest risk for serious diseases, violence, poor education and career outcomes, teen pregnancy, and incarceration. Many adults whose early years include some of the experiences I listed above are actually unaware of the effect those years have been having on them until decades later. So what kind of effects am I talking about? Depression, poor work performance, illicit drug use, financial stress, family dysfunction, difficulties with interpersonal relationships, and a raft of physical problems, including pulmonary disease, heart disease, liver disease, and alcoholism, just to name a few. And that truly is by no means an exhaustive list. The CDC Kaiser study found that 2/3 of their participants reported having experienced one ACE as a child, and 1 in 5 had experienced 3 or more, putting them at significant risk of physical and mental health difficulties as adults. This was a good-sized study conducted over many years. More than 17,000 people, in fact, participated, representing both genders and a range of ethnicities and education levels. The findings substantiated earlier studies that reported the higher an individual's cumulative ACE score based on the number, type, and severity of adverse experiences, the higher the risk for social, emotional, and cognitive impairment, adoption of health risk behaviors disease, disability and social problems, and even death. Next slide, please. Depression is one of the most common complications of chronic illness. Up to 1/3 of individuals with a serious medical condition experience symptoms of depression. Depression, as I mentioned earlier, one of the most commonly experienced mental disorders, quadruples your chance of suffering from a heart attack in the next 14 years. Research also suggests psychological distress may cause rapid heartbeat, high blood pressure, faster blood clotting, and lead to elevated insulin and cortisol levels. The rate of depression among individuals who have suffered from a heart attack is between 40 to 60%. Next slide, please. Anxiety, which is the leading mental health disorder, has a significant relationship with heart disease and stroke. Women with the highest level of phobic anxiety were 59% more likely to have a heart attack and 31% more likely to die from a heart attack. One major aspect of anxiety is panic, and the Women's Health Initiative found that a history of full-blown panic attacks triples a woman's risk of a coronary event, the arteries that encircle the heart, or stroke. Both men and women simultaneously suffering from heart disease as well as anxiety disorder are twice more likely to have a heart attack than those suffering solely from heart disease. Next slide. Both bipolar disorder and schizophrenia are highly linked to cancer in that adults with either disorder have a greater than twofold increased risk for cancer, particularly lung cancer, as suggested in a most recent study. Next slide. There is a strong relationship between eating disorders and heart disease, as we well know, and as well a link to diabetes. The obsessive eating disorder behaviors, such as starvation and purging, can lead to bone disease, diabetes, cardiac complications, gastrointestinal distress, and various additional organ problems. Additionally, people who experience mental health issues such as depression and addiction, as well as those experiencing chronic stress or poverty, share common problems related to appetite or eating. Stress changes how nutrients and waste are processed and move through our digestive system, often causing various types of discomfort and contributing to increased pain, especially for those with chronic conditions such as irritable bowel syndrome. However, how we eat, especially if it is too much, not enough, or the wrong type of foods, also has a tremendous impact on our mental and physical health. We are familiar with how our eating patterns affect our likelihood of diabetes and heart disease, but as well as the changes of eating disorders and obesity, yet oftentimes we overlook additional complications related to our eating habits. Next slide, please. Any working solution to costly health problems must be built upon a clear understanding that emotional, physical, and social health are inseparable. In the past, our system of healthcare alternated between the view that mental distress and mental illness is a personal or a character flaw, and the view that mental health disorders are brain diseases that must be cured with pharmaceutical interventions. We now realize, of course, that neither approach is fully correct. At the Chicago School, we are acutely aware of the need to integrate our field of study and practice into the wider realm of personal and public health. We know that psychology is integral to every facet of life, and that more importantly, it is a critical component of healthcare, vital to the well-being of individuals, families, and communities. As a mission-driven institution committed to improving the human condition, all of us are working every day to position ourselves at the vanguard of change. Our goal is to innovate the way psychology and counseling is taught and practiced, and to prepare the next generation of health professionals whose integrated approach to mental and physical well-being will result in a happier and healthier society. So with that said, what can we do to incorporate all aspects of health and be proactive about the mentioned correlations and causes? So first that I put out there for your consideration is holistic medicine. Holistic medicine is an approach that views the patient as a whole by not disregarding impactful elements such as nutrition, environment, lifestyle, and emotional and spiritual state. By averting an exclusive approach that isolates one problem and attempts to mend it, the holistic approach realizes the significant correlations between mental and physical illness. So, for example, a patient visits a conventional doctor for his or her recurring migraines. That person oftentimes is treated with a continuous use of medication. A holistic practitioner, on the other hand, would take a look at all of the surrounding factors and be much more likely to treat the source which could be anxiety, poor diet, environmental factors, stress, etc. If implemented and treated correctly and effectively, the holistic approach has a great potential for a person's well-being to improve, but also to be much more cost efficient. The next one is interprofessional care. Recent advances in scientific practice and research have given us valuable answers about why our healthcare system has failed to keep us healthy. These findings demand that our mental and physical healthcare providers, hospitals, healthcare insurance, and our government must now approach healthcare in a very different way. Interprofessional or integrated care places the patient at the center of his or her healthcare plan. Through this approach, health professionals, and by that I mean doctors, nurses, psychologists, behavioral health experts, counselors, dietitians, pharmacists, social workers, community healthcare workers, physical therapists, and indeed any specialist, that they work as a team to deliver the best care that focuses not only on physical health, but on mental well-being as well. This care model is informed by solid evidence provided by both research and practice, and it takes into consideration the patient's culture and the resources available in the patient's community. A patient under the care of an integrated healthcare team receives treatment that is tailored to his or her circumstances, behavior, and also stress factors. It's very different from the way that mental health care has been treated as an add-on or a carve-out in the past. Unlike traditional fee-for-service care that schedules the patient for myriad appointments with unconnected providers who don't share information, the interprofessional treatment plan is comprehensive in nature and highly coordinated from the very start. This new model of care differs from old versions of managed care that managed cost by limiting care without being held accountable for how this actually impacted health and well-being. The system currently being put into place under the Affordable Care Act carries with it a strong incentive for healthcare teams to keep patients well by connecting them to the right resources, including mental health care support, as part of a regular and expected care regime. The power of this model is very clear when we consider that by many estimates, more than 70% of primary care visits include a behavioral health care component. An integrated healthcare model does represent a change from the healthcare system that we all have become used to. Patients may be initially quite uncomfortable when asked for more details and in-depth personal histories, including information about their habits, their relationships, and so on. But this collection of information truly is critical to informing the varied members of a health team, each of whom brings specific expertise. In return, patients will benefit from more individualized support for physical health and mental health issues, stress management, healthy eating, and healthy activity, as well as highly specific interventions that practice evidence-based integrated care. In general, all of the research that we have currently suggests that the population will enjoy better health, a higher quality of life, and significantly reduced healthcare costs. There's lots of resources for people to learn more about this model and how they can work together to better their healthcare team in this new approach. All you have to do right now is Google these concepts and you'll see the myriad of conversations out there about this new approach to healthcare. Now, I would like to focus on the importance of the public health system and some promising approaches to integrated mental health into all of healthcare. There are common factors in each of these approaches. They make it easier for all people to get access to the right kind of care at the right time. They address all of the components of health, mental health, physical health, and healthy communities. They pay attention to the powerful influence that community and the environment have over health, whether it be stigma, healthy, healing social relationships, or an environment promoting healthy and healthful behaviors. And they improve the ability of individuals, communities, and healthcare professionals to collaborate on the goals of individual and community health. Each of the interventions represents an important contribution toward the goal of dismantling the long-standing wall of silence between the healthcare and the mental health care system. So next slide. I oftentimes say to people, seriously, but a little tongue-in-cheek, that when you're talking about these issues, you oftentimes meet two different types of people. One are folks that are very compassionate and truly care about the well-being of other people, and some will talk about, or at least their attention will be gathered when you start talking about the finances associated with everything that I've presented so far. So let's take a look at that on this slide about the financial impact of chronic illness. At the moment, chronic diseases, which include everything that I've already been talking about, cancer, heart disease, diabetes, they account for 75% of our nation's health spending, putting it at the very, very top of healthcare costs. Unhealthy consumer behaviors like smoking, obesity, and alcohol use account for $303 billion to $493 billion in annual treatment costs. Unnecessary or avoidable emergency room visit costs $14 billion annually in the United States. Also of note is in here the failure to address the emotional well-being of our young people, a time when proper mental health treatment could make a lifetime of difference. This has resulted and continues to result in enormous costs currently and down the road. And worse, this failure has resulted in a tremendous loss in worker productivity, civic participation, intellectual capital, and family participation. Meanwhile, millions of dollars are spent on incarceration, addiction, and healthcare problems too long left unaddressed. So the United States incarcerates more individuals than any other country. A Bureau of Justice Statistics report estimates that 705,000 mentally ill adults are incarcerated in state prisons, nearly 79,000 in federal prisons, and almost 500,000 in local jails. During a 3-month period, persons with depression are absent from work an average of 4.8 days and experience 11.5 days of reduced productivity. It's estimated that employee depression costs employers $17 billion to $44 billion yearly and causes an estimated 200 million lost workdays each year. Depression is the leading cause of disability in the United States for ages 15 to 44. And approximately 9% of U.S. workers report being hungover at work, and 15% report being impaired by alcohol at work at least once during the past year. Serious mental illness results in enormous personal, social, and economic costs, including an estimated $193 billion a year in lost earnings alone. Some 70% of young people in the juvenile justice system suffer from mental health disorders. 27% of cases are so severe that functional ability is seriously impaired. And according to a 2012 report from the Institute of Medicine, the indirect costs associated with preventable chronic diseases, so costs that are related to worker productivity as well as the resulting financial drag on the nation's economic output, may exceed $1 trillion per year. Next slide, please. In comparison, various organizations that are implementing a holistic approach have been able to reduce their health costs by 5 to 15%. So even if we only hit the lower end of savings at 5%, when you translate that into dollars, that's actually $24 billion. Next slide. So just as regular checkups, healthy eating, and exercise, we all know that that improves bodily health. We do know, actually, what individuals and communities can and should be doing to promote mental health. We also largely have ignored the social determinants of mental health as part of our general health agenda. There's no question that we all know adequate housing, safe neighborhoods, equitable jobs and wages, quality education, and equal access to quality health care, they all play individually and collectively a major role in determining health, both physical and mental health. So let me run you through additional things that we know works. We know that by addressing prevention in a comprehensive and integrated manner with high quality cause and effect data that ties social determinants of mental and physical health together, we know that that has positive outcomes. We need to develop awareness of environmental, economic, and social realities on symptoms tied to life circumstances, including social emotional stressors. And by the way, you all might know that a recent study by the American Psychological Association tells us that stress in the United States is at an all-time high. So think about that when I say that we're increasingly aware of the social and emotional stressors on immigrant populations. We are looking here at life changes, stereotyping, discrimination, prejudice, hate crimes, job adversity, and additional responsibilities while they have less access to resources. We're also increasingly aware that poverty and other such social determinants negatively have serious impacts on physical and mental health. So think about folks that are food insecure and also homeless. Think about the impact of on their lives. We need to understand the importance of reducing stigma around mental health and also of treating young people as early as possible. There is stigma, and some would say that it's no longer adequate to talk even about mental health stigma, that we need to start shifting our narrative to talking about prejudice rather than only stigma. We know it's there. We know it's very profound when it comes to issues of mental illness. We need to aggressively bring into open discussions issues about suicide and mental health. Suicide is the third leading killer of young people between the ages of 5 and 14. 5 and 14. The second leading killer of young people between the ages of 15 to 24. More teenagers and young adults die from suicide than from cancer, heart disease, AIDS, birth defects, stroke, pneumonia, influenza, and chronic lung disease combined. Family-based child abuse prevention programs must be accelerated. They must target parents themselves who have suffered abuse. They must hold the promise to reduce depression, post-traumatic stress disorder, and partner violence when these children themselves become adults. As I mentioned earlier, elimination or reduction of ACEs also reduces or eliminating the resulting long-term physical and mental health problems that children with high ACE scores are shown to suffer throughout their lives. 50% of lifetime mental illness cases begin by age 14. By 24 years of age, 75% of those whose lives have become impacted by mental illness will have their very first serious incident. We also must understand the impact that an individual's mental health issues have on those around them. Here I'm talking about work, about family, relationships, and the community. Awareness, for example, of the warrior culture on military families and the harmful obstacles that the core values of honor, commitment, resiliency, and toughness can create when veterans and their families are dealing with otherwise treatable mental and physical health concerns. awareness of the impact that mental health issues have on others, including those that are carrying imbalances as a result of increased responsibilities because of a family member struggling and suffering from physical and mental distress, and also in the workplace. I talk all the time, even here at the Chicago School of Professional Psychology, we always need to think as we're walking through the corridors that the person next to us, the person themselves, have these issues and are dealing with these issues on a daily basis. Increasingly, like today, we're using technology to contribute not only to the conversation about this important issue, but also to driving improved healthcare. So here I'm talking about electronic health records, telehealth, smartphone apps, and social media sites. This will only accelerate in the future. We need to, in our own practice and work, ensure that we are connecting across disciplines to provide wraparound services and resources. We need to share information and perspectives across departments for a big picture view. We need to provide resources to our employees and our students to support their emotional, mental, and physical health well-being. We need to educate the next generation of mental and physical health service providers to combat stigma and consider a more holistic and integrated view of healthcare, and also build, as I mentioned, holistic and transdisciplinary goals into all institutional strategic planning. I want to make sure that I leave adequate time for questions. Dr. Stretch, how are we doing? I'm happy to end there. I'm conscious it's just 10 to the hour, and I certainly want to leave time. The remainder of my presentation is belaboring some of these points. Perhaps I could end there and just ask for questions at this point. Would that work?
Yeah, I think that's a wonderful opportunity for us. So I'd like to open it up. You can type your question in the chat. You can come off mute and just share your question. And Dr. Nealon, I don't know if you can join us on video, but it might be helpful if they could see you.
Oh, thrilled. I thought I was on video all this time, so thrilled.
Hi, Dr. Nealon. This is Tiffany Rush-Wilson, and I have just one quick question. I'm interested very much so in the eating disorder slides that you showed, and wondered if those slides might be available to us to review, and then if we can send you questions, if we have any questions to follow up.
Always welcome to reach out to me. I will ensure that this entire presentation can be shared with participants. I'm happy to share those slides in general.
Thank you.
Thank you.
And I have them, Dr. Nealon, so I can, with your permission, we'll post them in our advising forum.
Okay, marvelous.
Other questions? We have a wealth of knowledge before us. We should definitely take advantage of it.
Dr. Nealon, you mentioned correlations between anxiety and stress and certain physical ailments. Do you have an opinion on like certain cancers and how like stress and anxiety could cause cancers like colon cancer to manifest?
I believe that was
I'm sorry, go ahead.
Oh, I was just saying, I believe that was Constance Fields.
Yes, I'm sorry.
Yeah.
I didn't introduce myself.
Yeah, so if let me just make sure that I understand your question. Are you asking for the biological mechanism that is involved? Are you asking, maybe?
I was asking if you had an opinion on whether or not anxiety or stress disorders can trigger or help manifest certain cancers in the body.
So there are two issues at play, and with many of these issues not 100% fully understood yet. Some research would say that certain individuals are predisposed to having certain physical illnesses, and the predisposition can be anything from really genetic makeup to certain biological vulnerabilities. Those individuals, so we all understand at the 100,000 feet level, the stress response. Stress and indeed anxiety, a little bit of stress and anxiety, if you think about it as a dial, or if you think about a thermostat that's circular in nature, not digital, electronic, it is very, very healthy for us to have a certain amount of stress and indeed a certain amount of anxiety. So I oftentimes give the example of if you were on the street and you saw a herd of elephants charging at you, what would you do? We all know that instantly we would head into a fight or flight response in order to, without much thinking, protect ourselves from the herd of elephants. This is healthy. Stress in and of itself is healthy. Think about taking a test. We want people to have a little bit of stress coming into taking an exam or a test, because that in fact fuels you on. If the herd of elephants is coming at you, the blood flow gets pumped into the major limbs, to your lungs and so on, that will put some speed in your legs to get yourself out of there. When stress is chronic, we know that through the release of cortisol and so on, that when you think about the dial, if you turn up that dial of stress, hormones and so on are continuously pumped through your body in a way that becomes very, very harmful. So I know this is very elementary, and at the same time, it's such a crucial thing to understand how all of these things work. So if our dial for stress or indeed anxiety is not only turned up, but left turned up, the normal healing properties that our body has, our body, for example, can cope with a certain amount of stress hormones running through it. It fuels us on, it motivates us, etc. But if that is left turned up, and those stress hormones remain in our body, we know that begins to systematically break down our physical functioning. So with stress, as you know as well, becomes lack of sleep, perhaps poor eating, problems with relationships, etc., etc. It is that continued breakdown of our systems that eventually will cause harm. I'm not a medically trained person, so I can't speak as well to the actual biological process of how that could impact, accelerate cancer. Yet we do know that something as basic as understanding the stress and the anxiety process and living and practicing all of the things that we need to do, sleep, eat well, exercise, manage difficult relationships, understanding when our stress and anxiety has outstretched our capacity and our resources to get us through those events, using our support systems, seeking counseling, psychological services, and so on. If we do not mobilize those systems, the response to stress and anxiety breaks our bodies down. Does that answer the question?
It does. Thank you so much.
I have potentially two questions, Dr. Nealon, if we have time. And this is Jennifer Toth.
Hi, Jennifer.
So my first question is, when conferring with the medical community, counselors might be dismissed from those conversations a lot of times. So how can we make sure that our presence is heard?
What a wonderful question. And I recognize that does happen, but I do believe that there's many things that we can do. One, we need to become as informed about the benefits of everything I've discussed. Education in these areas, and then the ability to insert ourselves into this conversation is the best thing that we can do. Be informed in a way that makes you highly credible and highly valuable. You can build relationships with medical practitioners, with specialists, in a way that not only demonstrates your credibility in that realm, but also by really advocating and promoting the importance of what counselors do. Crucial to understand the added value and then to learn how to communicate your added value in a way that demonstrates credibility, but also helps folks understand that you really are indispensable. One of the things at the Chicago School that I hope you're all noticing is at an institutional level, pushing out things as simple as there's no help with mental health, becoming advocates for our domains, not only within our own professional organizations, but reaching across to the medical profession in that regard. Conducting research in ways that is very applied and practice-oriented, and then openly pushing that research to folks that count. So when I was an intern way back in the day, getting my clinical psychology degree, for example, one of the things that I used to personally do, because I've always believed in this, I would prepare one-page executive summaries on things such as depression and anxiety, and I would work diligently with psychiatrists, and then on my postdoc in particular, with local medical practices to provide highly attractive, relevant one-pagers that medical doctors and so on can distribute to their patients. It takes time, energy, relationship building, knowledge, and so on. But without a shadow of a doubt, it was highly effective. And over time, we were able to build in my psychology practice and then with local medical communities, a really nice multidisciplinary approach to patient care, where it got us to the point where no psychiatrist or medical doctor had a client on psychotropic medication without an insistence and agreement from the patient that they would simultaneously see a psychologist or counselor within the practice. If you are working in community mental health, hospital settings, and so on in the future of your careers, again, being knowledge of, and I'm happy to provide my talking points as well if you'd like to have these for building these sorts of portfolios for yourselves, but really educating and indeed inserting yourself into the dialogue. If you're in a practice in the future that is not multidisciplinary in focus, bringing in outside speakers, bringing in expert specialists in this area during your team meetings and so on, just really strategically and purposefully advocating for this new way of being. Last thing I will say, because I know you had two questions.
You kind of answered my second question.
Oh, good, good. Then I'll finish my thought. The paradigm also in the medical profession, thank goodness, has shifted. So increasingly, the medical profession is recognizing the centrality of mental health and its impact on physical health. So medical professions have and are changing and are beginning to realize, even in areas of medication compliance, that one of the major issues they have in physical illnesses is that people simply will not stay compliant with their medication regimen. So they are pulling in counselors, behavioral experts, and so on, pulling them in to assist them with their clients in those crucial areas. So keeping yourself at the table in a highly informed way, and also enjoying this paradigm as it continues to shift.
So Dr. Nealon, thank you so much for your time. And unfortunately, we had a couple of questions from some students that weren't answered that I'm hoping that I might be able to maybe send to you, if that's okay.
I'd be delighted, yeah.
All right, so Michele, if you'll send me yours, I'll make sure it gets included. So just email it to me. I want to thank Dr. Nealon so much for her presentation. It was really informative, and for everybody's participation in the keynote. We have another series of sessions starting at 3 o'clock, so you can just click on the link if you're interested in one of the next sessions. We'd love to see you there. And thank you again for joining us.
Thank you, everyone.
Thank you, Dr. Nealon.
Thank you.